Welcome back to continue our discussion on influenza. I am here at Morton Comprehensive Health Services, and joining me again is Dr. Kelly Humphreys, family medicine physician. Let's jump in, doctor. Now, I want to come back and pick up on our symptoms again in terms of influenza in general. How does it tend to progress? What do people, is there sort of a general way, do you tend to get achy first? Do you tend to have a cough first? Do you tend to have a fever first? Is there any kind of overall progression?
Most people are reporting that they feel the muscle aches and the overall body aches first.
Okay.
Usually within 24 hours they come down with a fever and a headache. Usually then within 24 to 48 hours they have a cough, they can have a runny nose, you know, a little bit of the upper respiratory infection symptoms tend to set in, and a lot of the fatigue. Occasionally they'll have some diarrhea, but usually the GI effects are not as prominent as the rest of the symptoms tend to be.
Okay, and those can be, sounds like a little bit later compared
Yes.
to the others. Okay, now talk to me a little bit about, because people kind of get confused on that, about a cold. Because the way that you just described that progression, colds tend to start a little bit differently. You may not start off with the body aches and those types of things with the cold. So what about a cold?
Yeah, I think the main difference is, first of all, a lot of times when you have just a rhinorrhea or a common cold, you don't run a fever.
Okay.
What we're seeing with the flu is people are coming in with fevers, even adults, 101, 102.
Okay.
Number two, they'll say, I feel like I've been run over by a truck. I just hurt all over.
Okay.
The body aches are much worse with the flu than with a cold. So I think those two things tend to really set the flu aside and apart from a common cold.
Okay.
With the common cold, you tend to have more of the sinus congestion, the runny nose, the sneezing, the cough, that sort of thing.
And you might have the sore throat that
Yes.
you want to monitor, so it's not.
I have had a few patients, it's about 50%, complain of a little bit of a sore throat, particularly when they swallow, but you know, nothing, their throat won't be swollen, they won't have the glands swollen, not like what you get with the strep throat.
Okay, okay. Now, and as far as that, before I get into this other area of allergies, tell me a little bit about strep throat, because people need to understand how does a strep throat tend to appear and progress?
With strep throat, the main complaint will always be, I've got the sorest throat I've ever had.
Fire engine sore.
Yes,
Yeah.
I don't want to eat because it hurts so much. I don't even want to drink. And when you look into their throat, at the back of the throat, you will see what we call exudates, and these are white pus pockets of infection. And a lot of times, if you feel up underneath the jaw, you can feel enlarged lymph nodes. They'll be
Okay.
very sore, and the main presenting symptom is always the sore throat. And they may have a low-grade fever, they may not. They, you know, may have a headache, may not, but they won't have the body aches, they won't have the high temps that you get with the flu.
Okay, now what about allergies? Because sometimes people are like, well, the allergy season, how can I kind of tell what's going on there?
Well, especially a month ago, we were really having a lot of allergies, a lot of seasonal allergies, because we had a really high pollen count from ragweed and from the grasses, and also because I think it was very wet. I saw a lot of patients with that. They would come in with complaints of sneezing, itchy, red, watery eyes that felt like sandpaper, a little bit of a congested cough but non-productive, and they just felt a lot of fatigue. Usually when you have allergies, that makes you feel tired.
Okay.
And but no fevers, you know, no chills, you know, none of the other symptoms that tend to go with the flu.
Okay. Now let me ask this about looking back at influenza then. When we talk about that particular fever, and we're talking about 100 degrees or greater usually, Fahrenheit, how long should a person try to self-treat before they come into their physician if they're running this low grade, this fever? You haven't gotten up to 101, 102 yet. For sure, when you get up there, you need to, especially if you're not being
Yes.
responsive. But let's say it's around 100. What kinds of things should they do at home first? Should they call their physician? What should they do?
This is a real good question.
Yes.
And
One that I'm passionate about, and I'll tell you why in a moment. Go
well,
ahead.
and if you look at what the CDC has recommended, honestly, the recommendations have changed a little bit from when we first, got the word on the swine flu to now. As you know, it looks like the swine flu is most dangerous in children and pregnant women.
Right.
Because of that, of course, that's where we're trying to target for that population for immunizations. We are saying if you are in a household that has small children, has pregnant woman, then we need to, if somebody in that household starts running a fever, has been exposed to the flu, you need to get in for treatment. But also the person in that household who is at high risk should come in to be prophylaxed. In other words, they should be put on the antiviral medication prophylactically to prevent them from getting the flu if they have not already had the vaccine.
Okay. Okay.
Now, if you are not in a household that has someone at high risk and you're running 100-degree temperature, how long should you wait? And that's a good question. For most of us, it looks like this H1N1 flu is fairly mild. And there's even a question as to if all of us should be on antivirals.
Right.
And there's some concern about that because just as with antibiotics, we are seeing some resistance now with the Tamiflu. Now, they haven't seen any in the Influenza yet, but we have seen some resistance with the Tamiflu, and there's some concern, of course, that the more we use it, the more the resistance will emerge. Right now, the CDC is recommending that if you are fairly young and healthy, don't have any other health problems, and you get the flu, you can just stay at home, drink lots of fluids, rest, and take Tylenol, ibuprofen, something like that for the flu or for the fever, and you do not have to be on antivirals.
Okay. Now, should that fever respond, and we're going to take a really quick break in a moment,
Sure.
But should that fever respond within 24 hours to those measures of Tylenol or ibuprofen? And if not, then contact your physician?
Well, yes, and there's several things that are worrisome that are what I should say some warning signs that you should take heed. Number one, if you start to show signs of dehydration, if you can't keep liquids down, that's a bad sign.
Especially for children.
Well, for children and adults, if you start to get better, if the signs of the flu start to go away, but then they come back, that's a bad sign, and then you need to go to the doctor.
Okay, well, we're going to take a really quick break and come back and look at some more of those signs.
Okay.
Please stay with us. We'll be right back.